So Dr. Clark,
Yeah, thanks a lot.
take it away.
Yeah, thank you. Yeah, good morning, everybody. I hope you got sufficient rest and feeling ready for an awesome day today. So I want to begin, or before I begin, I always begin with a gratitude and thanking the people in the room for coming, for sharing your day with me, or at least part of your day with me, and to my esteemed colleagues who invited me to speak, and the whole team that's just done a wonderful job of, it's just been already pretty inspiring. So thank you to everyone. Thank you to all of you. So Dr. Nelson mentioned what my title is. Before we get started, one of the things I wanted to share with you is a little bit about my clinical background. You read some of my bio, but there's a couple of things I want to emphasize. And as I share with you a few lessons that I've learned along the way, particularly stemming from my early practice that still informs my research, my studies, my life, I would like to share a few lessons that I learned in that clinical practice. And while I'm doing that, I would really like you to think about yours as well. So my clinical practice before taking on a professorship, which was quite by accident. Yet, when I really reflect on those early days, my background is psych mental health. I'm an adolescent and family specialist. I'm also a therapist. And I worked with kids for a very long time, those who had very significant challenges, lots of challenges. Many had been adjudicated. Many, if not all, were struggling with substance use. A lot of them were unhoused, living in warehouses and so forth. And I had the complete and utter joy of working with one of the most incredible teams I've ever worked with. I call it my golden moment. And I'm one of those fortunate people who have had more than one golden moments in terms of my professional pathway. But when I reflect on those times and those early days, and my clinical work actually extended all the way from private practice to locked adolescent units. And I want to take us on that journey a little bit and think about some of those lessons that I learned that are still so relevant and really part of my DNA. And that is one of the first things I learned working with my team and with the kids was that strengths matter. These guys had been told, and if any of you have worked with populations like that, have been told over and over that they were losers, they were never going to amount to anything, and they were really disparaged by many people and told they would never amount to anything. I wish you had never been born. Messages like that. And so our team really believed that what matters is, yes, there are issues. We can help our teens manage and grow nonetheless, but we also need to emphasize their strengths. What's good about them? What's right about them? And so I learned that strengths matter. I also learned, because I had privilege of working as my co-director of that locked unit, a very gifted and award-winning adolescent psychiatrist. And she and I worked very closely together. And I remember her assembling us in one of our teams one day, a day that we thought, we don't really want to meet, we're exhausted, but I'll never forget that meeting, because it was in that meeting that she emphasized the importance of the 3 R's. So when you hear the 3 R's, what do you think of? Reading, writing, yeah, depending on where we were born in terms of our cohort, reading, writing, arithmetic, right? Well, she suggested that the 3 R's were really relationships, relationships, and relationships. But the relationships we build with our clients, with the adolescents, with the other people in their lives, that mattered. And then I also learned that civility matters. Civility matters a lot, particularly if we think about it in terms of being analogous with respect, respecting where that young person had been on their journey, what had happened along the way that informed their life. What were those events? And I think Dr. Hedges really summed up a lot. As she was talking yesterday, I'm thinking, you know what? Those are my kids from my clinical practice. And I was absolutely intrigued. And part of my undergraduate experience had been to study very deeply, in fact, have minor degrees in psychology and sociology, so that I could have a broader understanding of this thing that had motivated me from childhood even, and that is, why do we do what we do? What motivates human behavior? Why do some of us behave in some ways while others behave in other ways? So it was a total natural fit for me to enter the world of mental health and behavioral health nursing. It was a perfect fit. The other thing I learned in terms of Civility Matters is at that time, I had a very forward-thinking CEO who said, we're going to build a culture of regard. He called it a culture of regard. And it was one of the most formative experience that I had that I can tell you still informs my practice today. That culture matters. That culture will eat strategy for lunch every day. You've heard that being said. So I want you to think about, what is it in your practice or in your life that has you dedicated to your practice today, because it all matters. So here's what we're going to do, and I'm going to be cresting the waves, you guys, because this content takes hours and hours to really cover in any kind of deep or profound way. But we're going to do a couple of things. We're going to talk about, what are these concepts? What does civility mean? How about incivility? How about some of the other workplace aggressions that might find themselves in our work environments? We'll talk about the impact, not only on us as people, the workers within those health systems, our teams, the organization at large, but what about the impact on patient care? Which is really what separates us from, say, an English major. Not to diminish English majors at all. We've got a higher calling. So, and then there are many, many individual and organizational competencies. I'm going to identify a few. Some were already brought up yesterday. I'll amplify those a little bit. And then take us on a journey on what if it's in your mind that you want to elevate or transform your work environment? What are some of the theoretical groundings or pathways that you can take? So let's get started. And I start with this quote. I don't know if you've heard of P.M. Forney and read any of his works, but he is amazing. And sadly, he passed a few years ago. But for many, many years, he was the director of the Civility Project at Johns Hopkins University. And he has written many beautiful scholarly works on the topic. This quote is from his book titled Choosing Civility. And it was published initially back in 2002, so over 2 decades ago, yet it stands today because some of these concepts are enduring. So what Dr. Forney suggests to us is that a crucial measure of our success in life is the way we treat one another every day of our lives, which takes us immediately into the first concept I'd like to talk about, and that's civility. What is it? Why does it matter? Well, yesterday in the panel, I talked just a moment about a recent concept analysis that my research team and I completed and published in Nursing Outlook a couple of years ago. The very first concept analysis of civility was published by myself and one of my colleagues back in 2008. And I got to be thinking, during the pandemic, I thought, you know what, concepts change over time. And I'm wondering if in fact the concept of civility as we have known it in terms of its analysis and deep dive, has it changed over time? So assembled a research team. The third author there, Amanda Bentley, is actually a PhD student that I was mentoring on research and writing. I don't think she had a clue what it would be like to do a deep concept analysis. And for those of you who have done them, you know it's not for the faint of heart. They're tough, they're time intensive, they're labor intensive. But here's what we discovered. And as you might know, by the way, that whatever concept we're studying, we're going to be looking at antecedents and defining attributes and the consequences or the outcomes of that concept. But for me, the coolest part of that whole process is to say, okay, we have now gathered, I think from 17 countries across 10 or 12 disciplines, trying to figure out the operational definition of civility. And so what we discovered is what we had constructed back in 2008 with my former colleague. Civility has not really changed. The definition of it has not really changed over time, including during the pandemic and beyond. So you say, well, what is it? Well, we learned that civility is a choice. We make a decision, and that's why I led with Dr. Forney's quote. We make a decision about how we are going to interact with one another. And we decide that we're going to do that, if it's genuine civility, in a respectful way. And we do that because we want to build connections, we want to forge relationships, and we act in that respectful way even when, or especially when, we disagree. Now, is that easy? No. You know, we talked also a little bit yesterday about that human response, that tit for tat. If you treat me one way, I might come right back and treat you another way. So this is not easy stuff to hone and master whatsoever. I often say that it takes a lot of practice. We need to role play it. We need to debrief it. We need to take on these issues in real time when and if they occur. So if that's civility, what are all these other kinds of behaviors? We heard some discussion yesterday about incivility and so forth. But I want to share with you, and we won't have time to take a deep dive, like I said, but I wanted to illustrate this idea that these behaviors can and do occur along a continuum. So this is an updated, I also had an opportunity during the pandemic to update this continuum. It was initially published in Medscape back in 2009 or 2010, somewhere in there. I published it, it had a different name, and I really hated the name even though I gave it the name. And that was, I called it the Continuum of Incivility, and I always thought that was really a dumb name, because when does incivility stop being incivility and become something else? So when I revised it, and it had been revised a few times, but I hadn't changed the title, nor had I really thought more deeply about what some of those behaviors are and how we define them. So it works like mostly any other continuum. So if you look at the left end of the continuum and we see this idea of, or this concept of incivility, all right? We see incivility on that left hand of the continuum. I'm going to come back to that in just a moment, because I want to take us to the far right of that continuum. And I know we have a speaker later in the day that's going to be talking about workplace violence. When we get to that far right, we're talking about some very, very violent, threatening, aggressive types of behaviors where there can be harm, cruelty, and at the far right, what I call tragedy, which could be something horrible, like a hospital or a campus shooting. And then everything in between. Let's go back to the left side for just a moment, and you'll see that one of the examples I give is a rude nonverbal. So what are some rude nonverbals? Eye rolling. What else? Glare, like glaring, yes. Somebody said something else. Yeah, crossing our arms. Ignoring. You know what? Here's what I often say about nonverbals. You can do a whole bunch of them at the same time. You can roll your eyes, you can cross your arms, you can do that stare, you can slam the door, you can wave your arms, you can do all kinds of things, right? And guess what? I haven't said a word. But have I said something? Have I passed a message along? Absolutely. So one of the ideas I want us to grasp here is that though a verbal or nonverbal behavior may be on the left end of the continuum, it can have devastating effects. And one of the joys of my work is it takes me across the country, and I think our Canadian friends are here, and into Canada, talking with lots of students and asking students about this continuum. Have those behaviors happen to you? And what happens when and if they do? Getting into some really deep discussions with our students who say, you know what, when somebody rolls their eyes at me, particularly if I'm doing something in a patient room, maybe it's my preceptor, maybe it's my faculty member, maybe it's another health worker, it makes me think, who the hell am I? Whatever made me think I could be a nurse? Why did I sacrifice so much when it looks like I'm not going to be successful? So when we think that these nonverbals don't matter, they do. I'm going to give you one more example of a nonverbal. So a few years ago, a group of physicians did a study looking at what are the incivilities that are occurring. It was an awesome study, over 8,000 participants in about 12 different health systems. And what they were doing is gathering uncivil behaviors that occur in the patient care area and whether or not those had an impact on patient safety. The number one and there were several uncivil behaviors, but guess what? The number one was walking away before a conversation is over. Walking away before a conversation is over. Now, think about that. If you and I work together, okay? You're from Poland, right? But we work together nonetheless, all right? We're working together, and we're accountants, all right? So you're my team member, you're having a conversation with me, we're in an accounting firm, and I just walk away. Now, you might say, wow, that was really rude. Or you might think that was kind of disrespectful or certainly unfriendly, but guess what? No one's going to die, most likely. The chances are slim and none. Now, if we work together and we're both nurses, particularly if I need to do a complex treatment or procedure, and you're trying to give me information, and I walk away before the conversation's over, what's the outcome potentially? Yeah, could be harm or death to a patient. Certainly might be error. So when we think about this continuum, I don't want us to lose sight of the fact that we don't even have to move along this continuum for our patient care and our worker interactions to be affected. We also know that there is an undeniable link between stress and incivility, and I'm talking study after study after study, whether it's a qualitative study, a quantitative study, mixed methods. And my team and I, another team and I have actually used simulation and biomarkers to determine whether or not a newly graduated nurse, that was our group of people in the study, measuring their biomarkers to determine if they had an uncivil encounter before going into the patient room. All they had to do is two things that we were observing. They needed to assess the patient because they needed to give an antibiotic and they needed to give a heart rhythm med. What was happening in that study is that because they were treated uncivilly, those biomarkers went up. We now also have cognitive overload. I'm walking into a room, we're observing these newly graduated nurses, and they did not ask the patient whether or not they had an allergy. Basic nursing 101, right? Nor did they take a pulse before giving the heart rhythm med. Some did half. I'll tell you what, one of the newly graduated nurses went out, and we're in the sim lab, but we have a Pyxis machine, went over to the Pyxis machine and just stood there. Literally, we timed it 20 minutes, staring at the Pyxis machine. In the debrief, my colleague did the debriefing, but what we discovered is that the reason that person stayed there as long as they did is they were trying to get themselves under control. The stress had been elevated so high. So there are a lot of different factors that can lead to incivility, but when we are stressed, and by the way, we signed up for it. You know, we chose to be stressed because we're in a profession where life and death hangs in the balance. So it's less about the stress and more about how we mitigate that. So more on that later. So what are the impacts of that? And you can imagine what they are. I'll draw some from the research. So it's going to have an impact on us as workers, right? We're going to be impacted in terms of our morale, in terms of our productivity, in terms of our engagement, in terms of our intent to stay, all kinds of reasons. It messes up our interprofessional team. It diminishes psychological safety. It does all of that. It creates an environment where workers don't want to be. And we can ill afford to lose our workforce. Especially, I can tell you, and we heard some of it yesterday, people are leaving. And those happen to often be some of our rock stars, right? Because they don't want to be in an environment like that. So one of the things that we need to assist with, and when we get to the organizational part of this, is, and I always believe, in my teaching, so I was a professor for 20 years, taught a variety of courses, but the one I taught for 20 years was leadership and management. And I instilled in my students, look, you are the change agents. You are the leaders. What we're learning, you can transfer into your practice environment. You don't always have to leave it because you can change it. And we talked about ways to do that and how to speak up in spite of the fact that they're brand new workers on the floor. Okay? So some of those strategies here in a moment. There's also an impact on patient care, absolutely. Near misses, error, and so forth. And let me tell you this, we're seeing more and more research coming out on how it impacts witnesses. So we don't even have to be the one being treated badly. If I'm observing my colleague being treated badly, depending on how I'm made, that can have a pretty devastating effect on me. So we're working very hard to help people advocate and speak up. So there is so much rationale for why we're talking about healthy work environments. It's just like, I literally wrote the book on it. So, but I'm going to highlight a couple because they're so important. First one, of course, I just mentioned, creating a culture of safety and high reliability. That's so absolutely important. Data coming out. How many have read the National Plan for Health, Workforce, Wellbeing? If you haven't, I suggest you Google it, download it. It's been written and published now for all of us out of the National Academy of Medicine. It first came out in draft in 2022, and then they put it in final form last year. Great thinkers from across the country came together to say we need to help deal with the health of our workforce well-being. And how are we going to do that? So they identified 7 priorities, 7 main priorities with strategies on how to accomplish it. And I want to share with you priority number 1. And there it is. Priority number 1, we need to create and sustain positive work and learning environments and cultures. Bam. In fact, the authors concluded this is so important that if we don't do it, we're not going to be able to do all the other things we want or need to do because culture matters. The workplace matters. This is another one that came out the very end, I think November-ish of 23, an excellent report out of MIT Sloan. And what they did is they took 11 meta analyses. That's a lot of freaking papers, right? 11 meta-analyses, and they did the hard work of summarizing all of those analyses and work to say, hey, if we're going to, I'm not a fan of their title. I don't like the title of How to Fix a Culture. I'm more about how do we create a culture of civility, community, and joy, right? Nonetheless, what they did is they broke it down into 3 major, what they call critical areas, that if we're not paying attention to these 3, the rest is going to be very challenging. So the first was leadership. As leaders, all of you here, and of course, all of us are leaders, right? But we have to think about, are we modeling the way? Are we demonstrating the kinds of behaviors that we want others to emulate? Are we setting top priorities throughout campus, like the CEO I told you about? That was an entire campus initiative for our mental health center. All of it. That we were going to focus on creating that healthy workplace and a culture of regard. Okay? So what about norms? I'm going to talk about norms in a moment because in my mind, that's like a non-negotiable. We need to be formulating norms, and I think some of the questions some of you rose yesterday, you might go, if we had a charter with norms, that might begin to really help us create that healthy work environment. And then work design, thinking about what is the design of our work? What is the workload like? Is it flexible enough? Is it allowing us to find that harmony, right? That our speaker spoke about yesterday from Jeff Bezos, right? Are we being able to do that? And I might add, it's also stressing the importance of our organizations need to be providing us with the resources that we need. So, yeah, it's awesome to have personal responsibility for our wellness, but we also need a systemic response. Systems are highly responsible as well. And if you download the National Academy of Medicine report, they talk a lot about how important that is, that our systems support us. The codes of ethics, and I could pull a million more, but when we look at whether it's the International Council of Nurses, the American Nurses Association, the Canadian Nurses Association, you can pull your codes of ethics, all of these. And by the way, in the new code for the ANA, just came out in February, mid-February, get yourself a copy. It either comes in ebook or hard copy. In fact, as a professor, the ANA Code of Ethics was required reading for our students, and they needed to use it through every single course in our baccalaureate program and beyond. But in all of those, because I've gone and read them, they all talk about the importance of our role as nurses to create and sustain healthy work environments. In fact, the ANA calls it a culture of civility and kindness. So we have obligations. So how do we do all this? I'm going to spend just a moment, again, like I said, I'm cresting the waves. I don't have a lot of time, but I want to take us on a little bit of a journey about individual competencies, those things that you can do, that I can do, that individuals can do to add value to our work environment. So here we go. The first one I want to highlight is we need to be deepening our emotional intelligence, and as a component of that, heightening our self-awareness. Not always easy to do. And the data is pretty clear. When we evaluate ourselves compared to our coworkers, and there's a lot of work that's been done on that, including some of my own, our scores for civility go way up. Here we are. Even in a national study that was done, showed that people viewed themselves or perceived themselves in the mid-90th percentile as being very civil. Yet when they compared it to their coworkers, there was a 21% drop. So is that true? Consistently over time, is that true? That we're more respectful than our colleagues? Maybe, maybe not. Because unless we take that adventure on of improving our self-awareness, we may not know. I think it's also absolutely essential to know, what is our purpose? What is our purpose? And you see, their life without a purpose is like a body without a soul. Life without a purpose is like a body without a soul. So knowing why, your why, you've probably heard of Simon Sinek's work, who helps us understand why we do what we do. It fits with the song that Dr. O'Rourke mentioned yesterday. Why do we do what we do? How do we do it? What do we do? But why? And it's so much a part of us that it extends beyond our workplace. It's not our why only when we're there, but when we're everywhere. So my why is to lead. Let me read it to you so that I get it absolutely perfect. And for those of you who have really thought about your why, here's mine. To lead and inspire communities of civility and connection around the world so that all may thrive and prosper. That's who I am. That's how I live my life. So what is your why? And when you know your why, you'll find your way. I already talked about the importance of modeling, but here's a question I often ask. We are all role models, yet what are we role modeling? What are we role modeling? Are we approachable? Are we available? Are we listening well? Are we engaging? How do we dress? How do we speak? All of those things matter. And I can tell you, there's been studies, you know this stuff, that people make a judgment about us in a nanosecond, right? So what is the persona you wish to project? Particularly when I'm in front of a group of students, I think very intentionally about that. And then as an educator, laying my pedagogies bare, to quote Stephen Brookfield, one of the great masters of teaching and learning, we lay our pedagogies bare so that students will know, we're going to be spending some time, first day of class today, co-creating norms. Let me take you on that adventure so that we can do that together. So more on that later. So back to some individual competencies. Building psychological safety. We heard that mentioned yesterday. What is it? It's an environment where, and if you read the work of Amy Edmondson, I would recommend that you do. She really literally has really helped us learn a lot about psychological safety. And Amy Edmondson says, it's not only an environment that we feel as though we can bring something up without consequences of being ridiculed or put down or whatever, but in her words, we are obligated. We are obligated to do that, to advocate. And I love that, right? We heard some of that content yesterday, that advocacy, that speaking up. And so building those psychologically safe environments, very challenging. In fact, back in 2012, so more than a decade ago, maybe you heard of Project Aristotle. That was a research initiative by Google. And what Google was attempting to discover by assembling a research team, and they studied like 180 teams, I don't know for how long, but what they were trying to determine is what makes a high-performing team? What makes a high-performing team? And guess what? They found lots of things that go into creating a high-performing team, but this was number one. And they said, by the way, if you don't do this one, if you don't really work toward this one, none of these others matter. Well, they matter, but they're going to be very difficult to implement and to have those bear fruit. So creating that psychological safe environment. When I think about it, when I think about psychological safety in our world, I think just culture. Creating an environment where we are encouraged to bring forward any kind of error so that we can begin to seek solution and mitigate potential impacts. This is where I spend a good deal of my time with Civility Matters, and that is helping people hone and master, though I'm not sure any of us really master it, but on that trajectory toward mastery of improving our communication skills, our conflict negotiation skills, and doing that in large part by also listening. And we heard a lot about what I like to call mindful listening. And this is one of my favorite quotes that maybe you've seen, maybe not, but because I used to say, and I still say, listening is an act of love. Listening is an act of love. Think about the people in your life. If somebody's really paying you attention and really engaged and set aside their device. My daughter and I have that pact that we make. Our youngest daughter lives in Boise. We get together. I love it. She's like, Mama, got to put them away so that we can have a real conversation. And so being heard is so close to being loved that for the average person, they are almost indistinguishable, right? Seek and infuse joy. I'm going to ask you a question that I used to ask my students Did it for years, usually about midterm. And the question goes like this. So you think about it for yourself. How many hours per week, on average, do you spend doing the things that bring you joy? How many hours per week, on average, do you spend doing the things that bring you joy? And what I would do with my students is gather that data anonymously. It's simply a number, crunch the number, come back, maybe after break or the next day that we had class, bam, there's our number. Very often the number was very low, as you can imagine. So spending time to talk about how can we carve out time, and that might even mean me bringing that joy into the classroom, right? And by the way, if you're in higher ed, I know some of you are, most aren't, but the Chronicle of Higher Education in August, or no, it was maybe January, a couple months ago, anyway, had a beautiful article in there about how, as professors, if we infuse joy into our sims, our classes, our clinicals, students learn at a higher level. So let's keep going. How about this one? This is also an individual competency, expressing gratitude. The American Association of Critical Care Nurses has some beautiful standards on healthy work environment. Maybe you've seen them. One of them is meaningful recognition. Meaningful recognition. Now, what's meaningful to you may not be meaningful to me. So how do we find that out? How do we know how to meaningfully recognize our colleagues? Yeah. What would it be like? And it's easy to tally those up. You can do that even in a little survey, right? But being grateful, and this one is so critically important as well. All of them are important. But do we have mentors and coaches, people whose only skin in the game is to help us become the best versions of ourselves? Professionally, personally? What a treasure if you have someone like that in your life. I have several, and they have saved me from myself sometimes, literally. And so, by the way, a different research team, see, I love research, so I go out and I do a lot of research and I ask questions. And we recently, no, it's not, I think it was 16 or 17, we had the publication where we were measuring healthy work environments using one of my scales, and I was doing the psychometrics on it. Actually, the statistician, let's be clear, the statistician was doing the deep dive, which is why I always work in teams, right? Because I pretty much suck at a lot of things, but I'm pretty good at other things. We were measuring healthy work environment, and we had about 600 nurses, both from practice and education, to sort of study. And guess what the number one area of concern was? Because we also looked at strengths. What were our strengths? But what was the number one area of concern? This one. It got the lowest score. We are not terribly great at mentoring in nursing. And I'm talking about a comprehensive mentoring program, not a 6-week orientation for a new faculty or whatever. I'm not talking orientation, that's a piece of it, but full-blown comprehensive mentoring, including, like, toward the end of my professorship and when I was in my later time frame at the university, what I recognized is that the university at large had awesome mentoring for new faculty and staff, marginal for middle career, 0 for late career. So, and that's very common. So let's talk about the pathway because just have a little bit of time left. But you'll notice this picture here. I want you to pay attention to the picture for just a moment. The photo that I took. My husband and I love to trek. We're very physical people. We were trekking in Vietnam among the mountain people. We had to have a guide, of course, because it's a pretty remote area of Vietnam. And I took this picture as we were going up to meet with some of the mountain people. And the other reason I like to use this, because that pathway there, back in 09, so long time ago, one of my undergraduate research assistants, Dan Nguyen, from a very poor village in Vietnam, brilliant young man. He's now working as a, guess what, mental health nurse with adolescents in the Portland area. But he and I began the early stages of building what would become the pathway for fostering organizational civility, deeply rooted in theory, quantum physics, systems theory, preventive theory, and so forth. But let me take you on this little odyssey. So the pathway can be used as a framework or a structure to take us from being a less than healthy organization, or maybe you're doing well, but you want to be awesome. So wherever we are on that trajectory, the pathway can and has been used in many organizations. Very first step of the pathway is we have to have our leadership on board. And in this case, I'm talking about our executive leaders. So if we're academic, we're talking deans, directors, VPs, presidents, chancellors. It needs to be infused throughout the organization, and having those leaders on board really matters. If we're in a practice-based setting, it's our directors, our VPs, our CNOs, our CEOs, others, getting them on board. Because not only do they have a broader span of influence and a wider focus among what might be happening organization-wide, but they also are the ones who can provide us with the resources that we're going to need to move the unit forward or your department forward. The next step on the pathway, in steps 2 and 3 can be interchanged. I'm working with a very large university now where they already had step 3 was already in place, so it really is step 2. But at any rate, we need to measure what's going on, and I'm not talking about HCAP scores or campus climate surveys. Those are too big. So within your unit, measuring your work environment, because every single culture is different. And not only are we going to measure areas that we want to improve, but we're going to measure our strengths. And there's lots of different ways we can do that. Whether it's surveys, focus groups, there's a lot of ways that we can collect those data points. So this could be switched. Like I said, the university I'm working with right now, they already had a team in place. In fact, it was originally actually 2 of them. One was called the JEDI team, which was justice, equity, diversity, inclusion. Well, now we can't say any of those things anymore. Another one was their DEI initiative. And so what we've been able to do is broaden the mission of those teams. So it's not creating a new team necessarily, it's evolving those teams into have that mission 1, which is to create that healthy work environment. But without a team in place, the work is very difficult. So let me give you an example. Let's say that you, so if you're an academic and you need to write curriculum for your school, but guess what? You don't even have a curriculum team. Think it's going to be harder? Absolutely. Let's say performance improvement. for my practice colleagues out there, right? You want to do all that heavy lifting, or is it great to have a team in place? Same is true for when we are really paying attention to the health of our organizations. We need to have a data-driven action plan. In other words, write it down, drawing from that data. However you've collected your data, what are the priorities? The civility team or the culture team, or just change the name of of some of those, and I can't remember them all right now, but one of the schools I worked with in Canada, because they were serving a lot of Indigenous folks, they called it the Spirit of Well-Being Team. So whatever we call ourselves, we can begin to help organize on a data-driven action plan. What are our priorities? It's kind of like a QI plan, right? What are our priorities? What do we hope to accomplish? Which individual or team will be responsible for accomplishing that? And then later I'm going to talk about how important it is to celebrate our small wins and large wins. And so I'm often asked, okay, what's the secret sauce? And I say, you know what? There's a whole lot of things we need to do to improve the work environment. But if we do nothing else to co-create, co-collaborate with your team to create and implement norms and charter. So let me give you an example. So that's a pretty busy slide. The intent here, and if you want something like this, this is just an exemplar that I've written. So it begins with your institutional mission, and this fits on one sheet, by the way, and that's why I wanted to show it to you. Yeah, it looks like a busy slide. We're not talking about a dissertation. We're talking about a pithy, co-created, co-collaborated commitment to co-workers. So this is just one that I have grounded in the new code that came out. And then, so our code says nurses in all roles must strive to create a culture of inclusiveness, belonging, harmony, connection, community, and to create an ethical environment. I mentioned a culture of civility and kindness. So for me, that's a theoretical anchor. Okay, and then we make this commitment, and the most important, well, as important, is that we're co-creating norms together to say, what are we going to agree to on ways that we're going to behave and interact on our unit or our department. Those are just some examples. Literally, some of those are taken from the very first time I normed as part of our faculty and staff and leaders at Boise State. 2005, first time we normed with our clinical practice partners in the room to help us create that vision, mission, shared values. And from there, we were able to co-create our norms, including students. I wanted to show you this one. So I was hanging out, I think I was in the state of Virginia, but it was a group of nurse practitioners from all over the country. We got to be talking about norming and how important that was. And I had the permission from one of the attendees, because this one nurse practitioner stood up. She goes, you know what? I love this norm thing. She said, we call it the 10 Commandments of the ICU. She said, prior to having norms, what we did is have a lot of conflict, and she called it a shit show. And she said, what we were able to do is get everybody organized and think about what is it that we're going to commit to in terms of our interactions with one another. And it's a little hard to read, but you get the picture of what their commitment was to one another. And she said, it transformed the work environment. We need to pay attention to the people we're hiring, and not only to hire for skill sets. What about character? What about integrity? And if you ever want questions that you can ask as an interviewer of potential candidates. I have those. They're free. Just let me know. I'll send them to you. I also have questions that if I'm interviewing, I'm going to be asking you, because we want to have things in alignment. I don't want to work for a place that I might have to leave late. I used to work with my students on this a lot. You know, here are some questions you have in your back pocket. Ask the team that's interviewing you. Needing to have policies in place. So I'm going to encourage you to go back to your work environments and pull policies. Do you have a policy for a healthy work environment? And look at the language, because a lot of times they're there, but they're pretty ugly language, like the policy anti-bullying, not a fan. So look at how you framed it. Maybe it's an awesome policy, but maybe the terms need to be changed just a little bit. If you want, you can scan that QR code. So my co-author on this, it was published in the Journal of Nursing Education, because Katie Ritter is a university attorney. I am not a legal mind, so I needed a co-author who could say, this is for an academic institution, you would have to translate it a little bit for practice environments, but it's a template. Certainly you would have to check with your own attorneys in your institutions, but it's a template for how you can begin to develop and implement a policy. I mentioned the importance of celebrating our small wins, our big wins, and they don't have to cost a lot. I know budgets are tight. There's a lot of ways that we can celebrate without spending a lot of money. And I have lots of those ideas, but I'm running out of time. One of the last areas I want to wrap up is, so that's me and my husband. We were trekking in Nepal too. I had just had rotator cuff surgery, so it sucked. But good thing I could use my feet and legs, right? My trekking pole, the PT said, do not do this. Do not climb the Himalayas doing this. But anyway, really paying attention to our wellness, our self-care. And this is one of the ways that I do it. So these are people in my life. So that guy in the middle on that bike, that's my dad. So he lives in Tucson. My mother sadly passed many years ago from an accident. My dad still lives alone. He's 98 years old. That's a kick in the pants, that guy. Yeah, he goes, oh, Cinders, don't worry, I got you a bike. You can ride with me. So you see he's got this e-bike, right? You know what kind of bike he got me? This little old lady in his community that has one of those old-fashioned bikes. I'm like, Dad! He's like way ahead of me. What's the matter, Cinders? Anyway, that's my dad. He rides his bike every day. He lives alone, but he has a beautiful community around him. That woman in the middle, at the bottom there, that's my mother-in-law, who did yoga all of her life. She's 98 there in our home gym. She just passed. So I took that picture a couple years ago. She just passed away at the age of, she was almost 101. That little beauty on the right, that's my daughter, Emily. We have 3 children. One's a nurse, one's an engineer, and Em is a sound healer and an integrative coach. And she is one of my role models. And then I mentioned Nepal. See that guy in the middle between me and my husband? That guy can go and come back down and up and come back. I've never seen anything like the Sherpas in the Everest region who can do such incredible things. So I'll end here because I got a red light. So think about this. In a world where you can be anything, be kind. So thank you very much. Thank you, thank you, thank you. I don't know that I've got a red light. Okay, couple questions. Or good ideas. Yeah. I have a question about the Ten Commandment thing with ICU. Was that all inclusive? Yes. Yes. So members of the team that were part of that intensive care unit collaborated in a co-creating way to develop those norms. I've normed with my students too since 2005. Game changer. Anything else? Yeah.
The norm that said, oh, thank you. Could you elaborate a little bit about the norm that said build trust, naming nothing about me without me?
Yeah, so that was a school in Tennessee that I worked with. We were co-creating norms in a university there, and they had that as part of their motto, which meant that rather than go talk to somebody, if you and I have an issue, let's have conversation rather than me going and having a conversation about you with somebody else. And that extended into students too, not talking about other faculty to students.
Hello, me again, sorry. Question.
Tuesday.
Yes. So in terms of incivility, and I know Dr. Hedges talked a little bit about this yesterday. When you have employees, coworkers, peers that are just incivil because the way they were brought up, that is their defense mechanism. And say, despite coachings and counselings and speaking with them about it, they just don't see that it's them. In your experience or your recommendation, do you spend a lot of time on trying to get them into the group, or at what point do you kind of give up on them?
It's funny. I'm working with another school. I've got too much work. How about you guys? And that's exactly what's happening. And I spoke with the dean and I said, you know what? We've got 90%. Let's go. And hopefully those individuals will come along. If they don't, it may be a supervisory issue. Issue we have, and what I often advocate for is, a dean once said this to me, you know what, we have all this cool stuff, but we have no teeth. Meaning, how do you hold people accountable? And one of the ways we do that, and I know my practice colleagues out there do it way better than the academic world, and that is to build it into your performance plans. And we need to take a page out of that in the academic world. Yet a lot of my colleagues, not my personal colleagues, but academic colleagues in all disciplines will cry academic freedom. So yeah. Can I take one more? Okay, one more.
Yeah, thank you. The culture of civility is very personal to me because I wasn't trained in the United States. I migrated there like 15 years ago, and I had been a nurse for like 7, 8 years when I came here. So I had to transition, and coming from Africa to the United States, like I always tell myself, I felt like a little fish drowning in an ocean. And I experienced this in firsthand. And I want to say that it wasn't easy. I was an ICU nurse for 7 years, and my first job, all I needed was someone to hold my hand and say that this is where to find this is what, but it didn't go that way. But what helped was my inner feeling that, you know what, you are smart, you can do this. I took it every step, crying. Sometimes I had to spend hours crying in the bathroom just to pull myself together and come back on the unit to provide care. And my inner push, within 6 months, I became the unit manager. And because of what I felt, I decided to develop a mentoring program for new hires because I didn't want any nurse hired to go through what I went through. And like you said, in a world where you can be anything, be kind. And it's been 15 years, and up to today, I'm one of the managers, of course, and up to today, that mentoring program is helping. And anytime I look at these new nurses, like, thank you. I remember that first day, it was February 7, 2012, when I stepped on that unit and I was crying like a baby. So when I saw the topic yesterday, I'm like, oh my God, this is very important. Civility is something we need. Nurses, we need to stop eating our young because it's killing them. Thank you.
Yeah, you're welcome. And congratulations